So I'm Dave Strong. I'm a licensed professional counselor in private and hospital practice, and was asked to speak about women's mental health issues. In the United States, at least this year, 1 in 5 women will have some sort of mental health condition that can happen. And those conditions, such as depression, bipolar disorder, um, affect lots of women, and more women than men, and they're affected in different ways. But they can be treated and we can live well. So we divided this up on purpose into depression, mood disorders, anxiety disorders, and PTSD and trauma. Um, One of the things that I think is very important is realizing that if you have a mental health condition, you have something that is treatable. It's not the end of the world. There is a difficult time that some people have with recognizing that and being able to do something about it. Jeffrey R. Holland has a unique insight on this. And one of the quotes that I like from him was, "Don't you quit. You keep walking. You keep trying. There is help and happiness ahead. Some blessings come soon, some come late, and some don't come until heaven. But for those who embrace the gospel of Jesus Christ, they come. It will be all right in the end. Trust God and believe in good things to come." I think that's a great inspiration to start with. Uh, Depression, which is, at least at this time, given all that's gone on around us, the coronavirus and isolation, and all that, seems to have been more prevalent than normal. Depression, life is full of ups and downs, but when you feel sad or empty or hopeless, most of the time, generally extending past 2 weeks, that keeps you from your regular activities, you may have a depressive episode happening. Depression is a serious mental health condition that in the past year is twice as likely to affect women than men. And their symptoms tend to be a bit more widespread than that. It's not a normal part of being a woman. It's been a while since I was a woman, but I can guarantee you that's true. Most women, even those with most severe depression, can get treatment and can be helped. The hard part can be is accepting that talking with a professional like me can be part of the healing process. Being in, seeing a psychiatrist or your regular doctor and being on medications is also very helpful. The interesting thing about depression is that in about 75% of the cases, medication, talk therapy, and regular exercise has shown to be very effective in getting people out of that. So there's that to look forward to. As a mental health illness, it's really when somebody feels sad and crying often, but more so, they feel empty and hopeless most of the time. They lose interest in doing things, their regular activities, even their families. And again, this lasts more than 2 weeks. Depression affects their ability to work, to go to school, to have relationships, to be with family and friends. Depression is one of the most common mental health conditions that we see. And as an illness, it involves the body, our moods, and our thoughts, and it can affect the way that we eat, the way that we sleep, the way that you feel about yourself, and the way you think about things generally. Depression is different than being blue or down, because that usually only lasts for a few hours. Depression is also different from grief over losing a loved one, though they can end up in the same way. We used to have what we called situational depression, which was some event happened, an economic downturn, a death of a spouse, having to move. The situation would create that. Now we just sort of clumped it into major depressive episodes. And so we see that that's a difficult thing for women to have. The hard part is it's not something that anyone would will on somebody else, or can we will and wish away. It does take some work. People who have depression can't just pull themselves out of it. Different types of depression include a major depressive disorder, and it's called major on purpose. It really is something that affects most of our everyday life. It's a combination of symptoms that affect the body and our ability to sleep, our ability to eat, our ability to study, our ability to enjoy things. There's dysthymic disorder, which is a type of depression that lasts 2 years or more, and that can be very difficult. Sometimes it's referred to as treatment-resistant depression, though that's very, very often fairly rare. Other types of depressions have slightly different symptoms that may start after a certain event. Like I said, we had situational depression. Sometimes depression gets so bad that people start being psychotic. They start seeing things, hearing things, have delusions. That is very serious and is very treatable. What we need to do is make sure somebody that's like that is seen by a doctor. Sometimes it requires hospitalization, sometimes not, but it can be a very serious symptom. As I was researching this, I talked to one of the psychiatrists that I work with, and she's been practicing for 30 years. And she said that one of the more prevalent things is postpartum depression, which is a diagnosis that a new mother has that meets the criteria for major depression after the delivery of their baby. This isn't the baby blues. This is more solid and more down than that. Um, Most OBGYNs are really the first line defense for this. If you've had postpartum depression with one pregnancy, the likelihood that you will have it with the others is increased dramatically. And so these doctors are there and they can provide medications that are safe and that are very effective in helping this. The other thing that we can see is seasonal affective disorder. Seasonal affective disorder, or SAD, which is depression during the winter months. What we often see is we get into this kind of cave mentality. We're sort of hibernating. We don't really want to go out a lot. We don't do a lot. It happens when there's less natural light than what we're used to in the summer. The difficult parts start when the light comes back. That is the spring, right, like we're in now. There are several treatment options that can help with that, including light therapy. Even tanning can help. There are medications that are specific to seasonal affective disorder. Bipolar depression is the other type. People that have bipolar do have manic swings where they're on top of the world and feeling like $1,000,000. But the depressive part of that disorder is really, really difficult for a lot of people to overcome. In the last few years, there's been an increase in medications that are specific to bipolar depression. Counseling and therapy can often be helpful. Um, Trauma is always a difficult thing. There are bad things that happen to good people. Um, and whether the abuse is physical, emotional, verbal, or sexual, they can have a long term effect on their mental health. Women that have gone through abuse or other trauma have a higher risk of developing other mental health conditions, not just anxiety, not just depression, but PTSD is what we usually see. Remember that the trauma is never your fault, that you can get help with the physical, mental, and emotional scars from trauma and abuse. And there are a number of professionals around. Some of them do what's called EMDR, which is very trauma specific, that involves various things as far as helping. I don't really want to get into a whole lot of traumatic responses because that can be very difficult for the people that have been through that. But if you have that and need something, by all means, getting a referral to a professional will be helpful. The other thing that can be really hard for a lot of women is their body image. How do you think and feel about yourself generally? Um, in the United States, that's very difficult for a lot of people. Um, just glance through an online search for plastic surgeons, and you'll get an idea of how much that can be a problem. So the steps to get through that are looking at healthier body images, accepting yourself as you are. If you don't like where you are, doing something. The hard part for women can be pregnancy does seem to cause some difficulties in body image. Pregnancy is self-correcting, so it will come to an end. But the difficult part can be after that. The hormonal changes and other things can cause difficulties that are there. Mood swings are more often happening at this time as you have negative body images. But being comfortable with your body is really the key. If you want to look online to find ways of being comfortable with your body, there are a lot of resources out there, as well as seeking a professional to help. Menopause can be also one of those difficult times because it really is a big change. Um, you can no longer get pregnant. There are hormonal changes. There can even be body changes with that. And the difficult part is estrogen and progesterone, that are the hormones involved in that, have a large impact on our general moods and general well-being. Um, so very low estrogen levels can cause symptoms, hot flashes, and other things, and lead to depression. Um, Again, from Jeffrey R. Holland, be a woman of Christ. Cherish your esteemed place in the sight of God. He needs you, the church needs you, the world needs you. A woman's abiding trust in God and unfailing devotion to things of the Spirit have always been an anchor when the wind and waves of life are the fiercest. Regardless of the mental health condition that you're faced with, take comfort in the reality that fighting through the darkness and despair and pleading for the light is what opened this dispensation and what keeps it going. It is what will keep you going. On a personal note, obviously a number of years ago when I was getting divorced from my first wife, I traveled to a training in Kansas City by car. That was a good move. I was driving along and we met a rainstorm, lightning, thunder, and the whole bit that was just really intense. Not knowing a whole lot about tornadoes, I just kept driving. Ended up staying in some roadside hotel, and then early in the afternoon arrived in the city of Liberty, Missouri, to the compound where Liberty Jail is. There were branches stacked everywhere, but it was amazing how clean the grounds were. As we arrived, there was a smell of new paint there, and the couple that ushered us in said they'd had a tornado hit the neighborhood that night, and they had just finished repairing the roof and some other sections. Liberty Jail, for us as members of the church, holds where Joseph Smith received sections 122, 121, 122, and 123. As I walked around there, they have these printed messages around and sections of each of those sections. And I became aware that there was no darkness, no problem, nothing that life can give. And if you're asked, the very jaws of hell to gape wide, open their mouth after thee. Know thou, my son, that all these things shall give thee experience, and shall be for thy good. The Son of Man hath descended below them all, art thou greater than he. As it goes on, therefore hold on thy way, thy priesthood shall remain with thee, for their bounds are set and they cannot pass. Thy days are known, and thy years shall not be numbered less. Therefore fear not for what man can do, for God shall be with you forever and ever. I think the enduring message here is not that the Lord is admonishing us for thinking that we're greater than he, but I think it is that he has been through our suffering. He knows our pain. He knows what difficult times we have been through, and by his stripes we are healed. There is no darkness or suffering that the light of the atonement cannot overcome. Darkness always flees from light. In the name of Jesus Christ.